Hello from Texas, and just for a moment I'd like to share with you our newest release, Restoring the Intraradicular Space Aesthetic Post Systems. Recently, I read a comment by a dentist saying every root deserves a chance. This statement resonated with my philosophy because it is not only the tooth, but also the alveolar and the soft tissue architecture and the patient that deserve a chance. Over the last decade, I've witnessed patients presenting with fractured teeth that were referred for removal and implant placement. Upon discussing with the patient, it became clear that not everyone was given proper informed consent. Some were offered only the one treatment option. Thus, an awareness in the evolution of different disciplines in dentistry, combined with the common occurrence of misinformed patients coming for another opinion, stimulated my team and I to develop this book. This philosophy of choosing the least invasive procedure and moving to a more invasive one, if required over time, is an ethical one. The dilemma of preserving or replacing the compromised natural tooth is discussed in great detail with ample scientific support. Over 1,200 cited research studies are distilled into clear and meaningful guidelines for the clinician to select an appropriate system for the restorative management of endodontically treated teeth for each clinical situation. And clinical protocols are illustrated meticulously with over 800 photographs and figures. Chapter 1 provides a detailed and scientific description of the evolution of post-in-course systems while providing general design criteria and defining the components of the post-in-course system and how this information can assist the clinician in selecting the appropriate method and materials compatible with the existing tooth structure and desired results. Chapter 2, the adhesive design concept, although the majority of clinical failures involving post systems occur through debonding, unfortunately, many clinicians continue to use yesterday's concepts with today's modern materials, and they wonder why they have this challenge when restoring the intraradicular post space. This chapter will provide the clinician with an adhesive design concept that will result in a more favorable condition for an optimal restorative interface and a potential for improved clinical performance. It will provide a review of the various post systems, contemporary adhesive cements, and from the research of Dr. Burgess and Dr. Price will provide which post systems provide the most optimal light transmission. Chapter 3 demonstrates the information presented in the earlier chapters through illustrated case presentations while providing clinical applications for retaining the compromised tooth. The last chapter, Chapter 4, provides the clinician and technician with adequate information for proper assessment and decision-making in the treatment of non-restorable endodontically treated teeth and demonstrates through clinical scenarios and various treatment considerations and the critical factors that may play a role in the selection, outcome, and the predictability of each of these treatment modalities. To fulfill our responsibility to help patients keep their teeth as long as possible, understanding and selecting proper protocols, materials, and procedures to restore endodontically treated teeth is indispensable. Throughout these chapters, I would like the reader to direct their attention to modern applications in the fields of endodontics, restorative dentistry, periodontics, and orthodontics. In the past 2 decades, dentistry has seen a paradigm shift in philosophy that has been guided by a greater understanding of science. Advancements in endodontic technology with the use of modern instruments and new equipment, biocompatible filling materials, and microsurgical techniques have allowed the clinician to visualize, identify, and treat complexities they could have not fathomed a decade before. I hope you consider buying this book for yourself and for one of your colleagues or students. Remember, quintpub.com.